Okay, so as Lisa said, you all probably know me as the person who sends you emails advertising the forum, but I'm here today to talk to you about a couple of other projects that we've been working on in the last year or so. So we've been lucky enough to develop 2 new resources in the last 12 months in the youth portfolio. So the first one was a project targeting international students, and the outcome of that project was a series of 4 videos called Be Safe, Stay Well. And then the second resource I'm going to talk to you about today is the development of an interactive sexual health game called Infection Protection, which was added to the Get the Facts website earlier this year. So the first one I'm going to talk to you about is the videos. So we had a reference group that was formed 2014 sometime, and a lot of people came to us and spoke about anecdotal evidence around international students and clients that they were seeing who didn't really have a great understanding of sexual health. They didn't really know what an STI was, there was issues around pregnancy, and we kind of thought that there was a need for a resource to be developed targeting international students. So we know there's been a considerable growth in the international student population in Australia, and this is primarily due to university study and vocational training. And we do know that students overall, the literature says that they do engage in risky activities like unsafe sex and drinking alcohol, taking drugs, etc. It can be difficult for international students to adapt to Australian culture. We all know that sex is everywhere, and it can be overwhelming for people who haven't lived in Australia before, especially among those who have limited sexual health knowledge. They might not have had great sex ed back in their home country, so coming to Australia can be quite overwhelming for some students. So this includes information that needs to be provided around when to use condoms, female contraception, and around things to do with gender roles and violence and sexuality. So we wanted to provide an accurate and reliable resource for international students to get this information. So the goal of the project was obviously to develop a resource to increase awareness of sexual health issues among international students in Perth in order to maintain or improve their sexual health and wellbeing throughout the duration of their studies. So the target group was international students studying at a tertiary education institute and a language school within Perth, and this included both males and females, and we loosely set the age group from between 18 to 30 years. So in order to decide what we wanted our strategy to be, we decided to conduct some focus groups. At this stage we were leaning towards the development of a video resource, but we wanted to make sure that this was appropriate and this is what students wanted, and then to figure out what the content of this resource is going to involve. So we ran 3 focus groups. There was a total of 36 international students, and we had 22 different countries represented in these focus groups. We had 1 focus group conducted at the Oral Healthcare Centre of WA, and 2 were at Leederville TAFE. And we asked the group questions like, do you think having a sexual health resource would be useful? Would you know where to find sexual health information in Australia? And then we asked them things about what was the most important versus the least important sexual health issues that they wanted to know more about. And we also asked them about scenario-based questions around what they thought of using a video. Specifically, would they prefer a print resource or an education session? And then if they did think a video was a good idea, what would they include? What kind of aspects would be involved in that video process? So students reported wanting to know more about sexual health, safe sex and STIs. So these were some of the things or the questions that came out of those 3 focus groups. So students were keen to know about what is an STI, how much will it cost if I need to go to the doctor, how do I know if I have an STI, what are the laws in Australia around sex, and obviously things are different in Australia, but how different are they, and in what areas are they different? There were a lot of positive things that came out of the focus groups as well. So students agreed that sexual health issues were easier to talk about in Australia compared with their home countries. And this is because of reasons that they mentioned around freedom of speech, protection by the government, it's less shameful, you don't have your entire family around to find out if you've gone to the doctor for an STI test, and they felt like it was, there was less judgment here in Australia. So that was a really positive thing that came out of these focus groups. So based on that, it was concluded that developing a video resource was a good idea and it was welcomed by the students, which was great for us. We kept kind of going down that path. And we then just started the development of the scripts of the videos. But based on what the students said in the focus groups, we asked them, if you were going to develop a video, what would you include? And they mentioned things like using real actors rather than cartoons, making the actors look like normal, ordinary-looking people. They didn't want anyone too glamorous. They mentioned using actors from a range of different cultural backgrounds. Keeping the videos short was something that came up again and again and again. It was obvious that students didn't want to sit down for 10 minutes and watch some boring educational video. They thought that using humour would be good and don't make things too serious. Use personal stories, and they said that they would prefer that the videos were in an English language. So the scripts were then developed by our program and they were sent out to the reference group for feedback. And then we worked with a multimedia company to design and develop the videos. So the videos used animation and kinetic typography to appeal to an international audience whose first language isn't always English. They've been spoken by a range of different people from all across the world, so we sourced the voices from all over the globe and we listened to samples from each country and chose the sample that we thought was the most appropriate, the youngest sounding, the clearest sounding. And then we sent our top choices to an interpreter company who then listened and made sure that they could all understand them. So we wanted to do that so that the Middle Eastern male could understand the Southeast Asian female, and we wanted to make sure that they were all clear and really easy to understand. So the end product was 4 videos, which are around 2 to 3 minutes long. So we've got one on the importance of safe sex, sex and the law, discussing STIs, and health service costs. So these are live on the Healthy WA website. They went live on the 12th of March, and I checked yesterday and we've had around 1,150 views on our YouTube channel. The most popular video appears to be the importance of safe sex. I don't know whether that's because it's first on the list of videos on the page, so I might try and juggle them around. But we've had a good response from it. So I'm going to exit out of this and show you one of the videos now.
In my country, you're not supposed to talk about these things in public, but when you have problems, you should talk about it with someone you can trust. But in Australia, it's okay to talk about these things. You can talk about this with your sex partner and health professionals like doctors or nurses.
An STI is a sexually transmitted infection spread through sexual contact. Not many people realise that STIs are really common. It's important that people understand this so they know how to protect themselves.
I don't really know what sex diseases are in Australia.
I only know about HIV and AIDS. I don't know anything about others.
There are many types of STIs. The common ones in Australia are chlamydia, gonorrhea, herpes and hepatitis B. Syphilis and HIV also occur in Australia, but they are less common.
People who have an STI often feel completely well and don't know that they have an infection. They look and feel healthy, but the infection can be like damaging them inside, and they can pass on the infection to their sex partners.
Anyone who has had sex without a condom could be at risk of having an STI. But it's not all bad news, because most STIs are easy to treat.
Where I'm from, buying condoms is really awkward and embarrassing. But here it's better. There's no shame in buying condoms and talking about STIs.
There are many free clinics and services in Australia that you can go to talk about STIs and sexual health. If you don't know where to go or have a question, you can start by calling the Sexual Health Helpline on 9227 6178. They are there to help, and no question is too embarrassing to ask. Remember that the information you tell a doctor or nurse will not be shared with anybody. This includes your university, school, or immigration.
For other international students, my message to you is protect yourself, your sex partners, and protect your family.
Okay, so there's 3 more, which I'll put the link is up at the end of my presentation. So you can go on Healthy WA and have a look at them. They're easy to search for as well. One thing I forgot to mention was a lot of the quotes from the videos we actually took from the focus groups. So we recorded the focus groups we ran, and some of the quotes in that one, like, I only know about HIV and AIDS, I don't know about any others. That was actually from a lot of the students and things that they said, and the fact that buying condoms in their home country is shameful and here it's much better. So we tried to make the videos reflect the students' views as accurately as possible. So I'm now going to speak to you about Infection Protection, which is an online interactive game to educate young people on sexual health, and it's now live on the Get the Facts website. So for those of you who don't know, I'm sure most of you are aware, but Get the Facts is a website that provides sexual health and relationship information to young people between the ages of 13 and 17. So we know that website content needs to be continuously updated and modernised in order to increase traffic and engage with users. So the use of games for learning is well recognised as a useful method, and it's innovative and engaging way to kind of present key messages to young people. So we wanted to update the website and modernise it, and we ran a 3-stage game competition in 2014. So the criteria for the game was that it had to appeal to young people between the ages of 12 to 17. The game had to educate or inform people on sexual health, bloodborne viruses or relationships. It needed to foster active learning amongst the players, and it had to be something that was easily recreated. So the idea that people put forward had to be something that game developers could take away and recreate. And of course it had to support and correspond to, somewhere of the Get the Facts website. So the game contest didn't have an age limit. However, people under the age of 18 who did apply did need parental consent for that. So the first stage of the competition was the development of a game design document. So that was drafted, and it included information on the age category, the application process, information on judging and criteria, terms and conditions, and then some information on what each stage of the competition would include. So basically the document asked participants to fill in information on what was their game. So what was the key concept of their game? What was the story, the setting, the characters? Was there going to be music? What kind of sound was there going to be? How would people play it? Would there be levels? So all this information was asked, and it was kind of open to anyone to interpret a game however they like. We didn't get a heap of people submit games. I tried to promote this as far and wide as I could, but I'm not really in the gaming scene, so it was a little bit difficult for me. But we did get some entries, and the winning entry was chosen, and they received a prize. So stage 2 was we ran a 2-day game jam, which was held at ECU in November last year. And for those of you who don't know, I didn't know what it was. A game jam is a 2-day intensive thing where people get together on computers and develop a game prototype in 48 hours. And we just fed them and left them there, and they developed these game prototypes for us. And there was 3 teams that completed or participated in the game jam. So that was interesting. But the winning prototype was called Infection Protection, and they were actually the team that won the first round as well. So they were all up in the gaming world. So that was good. And then we contracted these 2 game developers who won to make final changes to the game so that we could upload it onto the website. And it just required a few tweaks and things to make sure that it was appropriate. So Infection Protection uses a simulation of characters who engage in sexual activity with one another. The user must check the characters for medical updates, send them to the clinic when required, and to treat their STIs and provide safe sex packs to the characters. The game has 3 levels and is completed after all the STIs in the village have been eliminated. Here are some screenshots of the game, because I don't know if I'm able to show it to you, but the first one is the home screen of the game, which is actually getting a bit of a revamp at the moment. This is an older screenshot, but basically there's the little characters. You click on one of them and their information comes up on the left-hand side. So they've got whether they've got symptoms. Not all of them have symptoms, but some of them do. And then you can choose whether to send them to the clinic. They go over there. They'll come back with an STI if they have one, and then you choose the treatment and you can give them a safe sex pack. And basically there's more STIs in each level and there's more people. And what they do is they thrust at each other like that. And they do that a lot. And it gets faster, and so you can see how far you can get. It's easy to get to level 3. I haven't completed the whole thing yet, but I think Lisa maybe has. So check it out. It's just on Get the Facts website, and you can have a play and take some time away from the documents you're all writing and play something a little bit fun. So the game went live on the 19th of April, and since then we've had 1,580 views on the home screen. So the average time people are spending on that home screen is about 54 seconds. So we're assuming that they are entering the game and playing for a little while, which is good. And we've got advertisements all throughout the site on every page advertising the game, and we know that people are clicking on them to get to the game homepage, which is great. We're actually working with the game developers at the moment to develop some more in-depth analytics. So we're working with them so that we can track the number of people who click play, the number of people who finish each level, and the number of people who complete the game. And this was something that I had kind of overlooked in the process of all of this and just assumed that that would be able to be tracked, but it's not, so that's something we're working on at the moment. So what's next? So we're continuing to promote the videos online. We've currently had 15 organisations provide a link on their website. There's been over 20 posts on social media promoting the videos, and they've been featured in 7 newsletters. So I just want to extend thanks to all of you who have assisted me in promoting this resource. It's much appreciated, and anyone else who wants to put a link up to the videos, if you think it's appropriate, just let me know. And we're also evaluating the resource, and abstracts have been submitted to a couple of conferences for both of these, which is good. So that's what the people do in the game. Not continuously like that. They do stop and meet others and do the same thing. We do have heterosexual and homosexual sex featured in the game as well, so they do face the same way and the other way. So it's good. So both of these resources are available online. The PowerPoint will be uploaded to the WA Health website after this, so you can have a look. And I've put a few resources out on the front table if anyone wants to grab them. I have plenty more in my office, so please contact me if you want any more of the little pamphlets. So thank you.